Good afternoon, everybody. It's the 29th of June, Monday, and welcome to our COVID-19 daily report. We wanted to start this afternoon by jumping right into the numbers. This was a very difficult weekend for Pinellas County and for the state of Florida. I was speaking with someone who had just recently done some research, and he shared with me an interesting fact. I almost couldn't believe it, and I went back to confirm it, and it is actually an accurate number. The number of COVID cases has jumped five-fold in the last 14 days. Think about that. In the last 2 weeks, we've seen 5 times the number of cases that had occurred in the previous 18 weeks. So the numbers are growing pretty rapidly right now, and you're seeing this reported on all of the major news channels and of course in the government as well. Our cases over the last 2 days, Saturday and Sunday, the change in the number of cases here in Florida, 141,000. That is up 26,000 new cases in a 2-day period, with 3,419 deaths. Here in Pinellas County, more concerning because it's local, we saw a very significant increase as well. We are at 5,947 cases. It increased 350 new cases over the weekend. That is significant because it's having an impact in not only Pinellas County, but also in our specific zip code. So here in Pinellas County, our hospitalization rate is at 707 residents, and in our specific zip code, we're now at 99. That's an increase over the weekend of more than 20, and again, that's very similar in all the previous months before. We had gotten up to 80, and now we've seen an increase of nearly a fourth of that, a little between a fourth and a fifth of that in one weekend. We are entering day 25 of phase 2. The governor is looking at rolling back some of the restrictions that he has lifted. We've seen a couple of those happen at the end of last week. Bars are no longer allowed to serve alcohol, and we've seen that there are restrictions being placed on access to Florida beaches as well. Here in Pinellas and Pasco County, if you are out in public, you are required to wear a mask if you want service. Testing continues to increase, but at a very slow rate. Testing is now at 89,923, and the infection rate is running at 6.7. We've seen that go up each and every day over the last week and a half, almost 2 weeks. So pretty clearly, we have lost control of this, and we can expect to see that the national government, the state, the county, and yes, those of us at Regency Oaks are going to be stepping back and curtailing some of the freedoms that have been passed on. So those kind of changes can be anticipated, and we can look to see more direction coming from CDC and the appropriate healthcare agencies that are guiding the response to COVID. The number of individuals that we are monitoring here at Regency Oaks has also increased. I was able to send a letter out Friday afternoon talking about a second COVID positive. And I wanted to update you and share the latest numbers here at Regency Oaks. In our independent living, we are tracking an all-time high of 32 residents that are currently in quarantine. We do not believe any of them are currently symptomatic for COVID, but it is the highest number of individuals that we have ever tracked. In our skilled nursing, we are tracking 3 additional folks in quarantine, and in our assisted living, where we've had an outbreak, all 25 residents in assisted living are on strict quarantine, and we have implemented what is called droplet precaution. And under droplet precaution, that means the staff is fully doffed and donned. They are wearing full PPE, personal protective equipment. That's a gown, a mask, a face shield, goggles if appropriate, and gloves. As we monitor that situation, quarantine the residents, and we had all of them tested on Friday. We are waiting for results to come back and see where we are there. In terms of our staff members that are quarantined, we currently have 9 staff members in the independent living that we have on quarantine that we are tracking, and we have an additional 10 over in the assisted living and skilled nursing. So altogether across the campus, including PL, we now have 19 associates in multiple departments that we are tracking because we are concerned that they may have had an exposure to COVID or they are symptomatic for COVID. All of these individuals are tested or in the process of being tested, and we're waiting for results before we move forward. I did want to share with you that this is fairly widespread. It is more significant in the assisted living than anywhere else on campus, but it's CNAs, housekeepers, our maintenance department, our dining, and yes, our programming department as well. And so it's very typical of what you might see where it's broad and it's widespread, and it's coming from exposure and being out and about, and in a broader sense being a part of a community outside of Regency Oaks. And so we are continuing to monitor that, and we'll keep you up to date as things change. In terms of individuals, both residents and staff, exhibiting COVID or flu-like symptoms and testing in progress, waiting upon results, we currently have 1 resident and 12 of those 19 staff members that we have not ruled out yet for COVID. Our confirmed COVID cases has jumped to 2 residents, 1 in the IL who is completely recovered, 1 in the assisted living who has been hospitalized, and 4 staff members. 1 in our IL, 1 in our assisted living, and 2 in our skilled nursing. All 4 of the staff members are in quarantine, self-imposed quarantine, and they are recovering. We talk about the curve, and we track those numbers to look at the number of people who have been tested and are recovering, as opposed to the people who are ill and in treatment, because that's eventually how we will overcome the COVID issue. Those numbers today is We have 75 residents that we have tested and are negative, and we have 122 staff members that we have tested that are negative. So those numbers continue to accelerate as well. So I know these are not the numbers that you wanted to hear, nor are they the numbers that I wanted to share with you. But what I did want to do is take a few minutes to talk about how you can continue to be safe and about what additional measures the staff is taking to make sure that you are safe and that this virus can be contained. Over the past several weeks, our staff has been working toward this. We've been training. We have confidence in our plan to keep the community safe and prevent the spread of this virus. The safety and well-being of our residents is our number one concern, and I wanted to emphasize that although this is a very scary time and recognize that we are at an at-risk population, there are countermeasures that we can pursue and work on together to make sure that all of us will be safe. We took the time this morning to go back into the archives and share with you a video on hand washing technique. Hand washing is the single most important thing that we can do to ensure everybody's safety. There are a couple of other things that I know you're familiar with, but I just wanted to reiterate at least one more time. Practice good social distancing. Wear a mask when you are out in public and away from your apartment. If you are feeling ill and have flu-like symptoms, don't leave your apartment. Reach out to Leslie, the front desk, myself, and report those symptoms. The ability to be aware of your condition early means that we are better able to get you the required testing and assistance and medical support to make sure that we minimize the impact of dealing with a COVID diagnosis. Frequently disinfect your personal space, whether it's the refrigerator handles, your doorknobs, the sinks in your bathrooms. Frequently sanitize and disinfect. Try to avoid touching your face. That is a really significant means of transmitting the virus, and keeping your hands down and away from your face is really important. I also wanted to just give a little bit more information about additional steps that we're taking to help ensure your safety and prevent the spread of coronavirus. Last week we had announced that we were coming back with Tuesday Talk and some of the live departmental shows. We had talked about a loosening of restrictions for gatherings. We are pulling back on that. Tuesday Talk and the other departmental presentations will not start now, and we are going to stick with our current limit of 20 people in small group gatherings, appropriately masked and with good social distancing going forward. Additionally, we have gone back and re-educated and worked with our staff, just as we are working with residents now, about the importance of good hand washing techniques and wearing a mask anytime you are in public. We are working with Jesse and our housekeeping team on sanitizing and stepping up the cleaning of our common areas and surfaces to make sure that we're not spreading the disease from one person to another through surface contact. We continue to restrict visitors. Residents are currently not allowed to have visitors inside the interior. They currently are allowed to see family members on the outside outdoor spaces. However, we want to encourage you not to do that. It's individuals who are out in the community at large who potentially could be the exposure source for the community, and that is not a best practice that we would encourage, although at this point we have not discontinued it. We've canceled all of our large group activities, including bingo and any large town hall presentation like forum or ROVA or a RORO quarterly meeting, and all of that is being done virtually. We have reviewed our emergency preparedness plan for plagues and have made sure that we are executing against our predetermined plan and keeping you safe. If you are planning travel in the immediate future, please share with us your travel plans, how long you're going to be gone, where you are going, who you will be traveling with, and your destination, so that we can continue to make sure that residents are not traveling into hot zones across the country or internationally. We are communicating on an everyday basis with other communities in our network and sharing best practices. One of the things we picked up this week is the idea of having a forum call where if you have a loved one in the health center, you'd be able to call in and have a 30-minute direct communication and update, and the ability to ask questions about your loved one's care in the healthcare setting. So that is something that we'll be instituting this week as well. And then the one last thing that I want to mention is we are in constant touch with CDC, the Centers for Medicare and Medicaid, always looking for the next best practice that we can implement and bring back to Regency Oaks to make sure that our residents are safe and secure. So again, just in closing, I know this is very stressful, but Regency is prepared. We're well trained for this. We're confident that the measures we are taking can save lives and prevent an outbreak across our community. We're asking for your continued support and understanding as we try to walk through these very difficult days. Everybody, be safe. Thank you for joining us this afternoon, and we'll talk to you again on Wednesday.